programs and services, WellFort delivers high-quality care, focus on prevention and health promotion, applying health equity to achieve what we envision, a healthier community where everyone belongs.
So as a community health center, we serve a large marginalized community, and one of these special populations is a non-insured population in Ontario, but particularly Malton, because that's the area that we serve. We are funded to do this in a very special way, and we allow them to seek primary care with us, but also specialist care. They get to do any kind of testing that they need outside of our center as well. And this is particularly important to prevent the progression of disease and provide preventative health care before diseases progress. And we know that this is a huge issue in Ontario because 500,000 people don't have access to OHIP, and so we're very proud that we're able to serve this non-insured population.
Last year, the dental team provided care to over 3,000 clients. It's a tremendous opportunity and experience to work with two of our most vulnerable populations, seniors and children.
Bloom is a really special program, a part of WellFort Community Health Services, where we get to go into the community and see people that are street involved or involved with the correctional system, people who are struggling to access mainstream healthcare, specifically to access services and testing and treatment for HIV and Hep C. We do mostly street outreach, and we're embedded in the community throughout Mississauga, Brampton, and Caledon.
One of my most favorite experiences at our center was with a family who came from Colombia. When they were living in Colombia, they were under threat. They were actually fearful for their lives. They learned about our community health center, and we welcomed them to our community health center. They had no status. They applied as refugees. Their refugee application was denied. They appealed, it was denied. Then we worked with them to submit an application for humanitarian and compassionate grounds. I wrote support letters, and I worked with the family to help them deal with the symptoms that they had, because they had severe anxiety, depression, and post-traumatic stress. Over time, with medication and with counseling, so using our clinical counselor and working with our care and support navigators, we were able to help connect them to supports that they needed. I'm so happy to share that in the last year, they were approved for permanent residency. I think that was one of our biggest success stories, because we were able to save them from going somewhere where they would have been killed.
Peel region has we are actually #1 on the map in Ontario of people living with diabetes. So working for an organization in a region where diabetes is very prevalent, and knowing that we have the opportunity to make change, perhaps prevent, and provide every day a learning opportunity for those individuals who are at risk to develop diabetes, and maybe work towards prevention as opposed to diagnosis. I think one thing about this organization that really makes me proud is it provides an opportunity for highly qualified healthcare providers and the support staff that we work with to provide quality care to the clients that we serve. Not just the clients that we serve, but the community in which they live in.